What are your concerns with what your colleagues are proposing right now?
We have not read through the most updated, but what I can tell you is the first draft that came out a few weeks ago, we do have some problems with, specifically in a couple areas, the Medicaid expansion and the refundable tax credit. I did hear your lead on. We're not pushing back with administration. Right now, our struggle is this is the House plan, and we want to make sure that we're maximizing the opportunity. We only get one opportunity to get this right. We want to make sure it's the most conservative perspective while also covering as many people or providing as many health care choices for the American people.
Suffice to say, you know this, the House Speaker knows this, he needs your vote for this thing to get through. What's the quality of dialogue like between you and that study group and the House Speaker and his leadership team?
Well, I think it's been great. In fact, we met twice yesterday. I've also spent some time yesterday afternoon talking with Dr. Price over at HHS. We're getting closer. We want to try and get there, but right now, for example, Medicaid expansion, Obamacare paid up to 138% above the poverty line for capable-bodied people to be able to have full Medicaid. Now, the problem with that is we've got to put a cap on that. Some of these things aren't going to be solved in 10 years. The other component of that is what kind of tax burden are we asked the middle-class Americans to pay? Over the next 10 years, it's $700 billion under Obamacare. All we're asking is what is our number? What's the difference there? Before we can just sign the blank check, we need more information before we can get to a yes.
Let me ask about what you're hearing from constituents. The president in his in remarks before the speech this week saying he wants to do as much as possible here to make sure everybody gets to keep his or her coverage. When you're in Siler City or Yanceyville, when you're back home talking to constituents, what do they say to you about coverage, how important it is for them to have health care coverage?
For someone to know those cities, somebody
I've
must
been
have a
there. I
connection
know.
with North Carolina. You know what? There's a couple things we get out of it. One is the first instinct is to support the president. They feel like there's strong evidence to support that President Trump is wanting to get some action. We understand that. The other component is they're wanting to make sure that they're not stuck with a bill when it comes to paying for these additional taxes. So if we're going to create separation from what the Affordable Care Act was to what our plan now is, it should come about with tax relief at the same time, not additional taxes to pay for coverage for the entire country.
I'm glad you bring up taxes here. I got a couple questions about that as well. It sounds like from everybody that I talked to here, before we get to tax reform, we've got to get through Affordable Care Act reform. How big a hurdle is that? Is it possible to work on these two things at one time, or do we have to focus more exclusively here on the Affordable Care Act for now?
I would say yes and yes to your question. There is a lot of energy being put into the Affordable Care Act. Yet at the same time, we just had a meeting this morning as RSC chair. We've got 155 members. We are putting together our own budget, and this morning we met for an hour to talk about the tax reform part of that budget. So both are happening simultaneously, but it would be remiss if I didn't say the basic part of this week, as well as a lot of the energy, is trying to get this thing resolved, because Republicans believe that if we can get this done, everything lines up behind this year for what could look like an incredible successful year for Republicans.
How difficult would it be for you to swallow a border adjustment tax? Is that something that you'd be in favor of?
At this point, we're still reviewing the numbers. We've talked to many different companies. We don't want to put something on there that impacts a lot of people who hire many manufacturer jobs. So we want to make sure, if I was to pick it or choose right now, I'm leaning that direction. But for me to say, hey, this is exactly where I'm at right now would be a little premature.
I don't know if High Point is still in the 6th District in North Carolina, but I know manufacturing has been important in that part of North Carolina for a long time there. When the president talked about his plan for infrastructure spending, when he talked about $1 trillion there in public-private partnerships, did you stand up? Did you applaud when he was talking about that the other night?
I applauded. I don't know that I've applauded the $1 trillion yet, but I did applaud the infrastructure component because it is something that's huge. If you look at mandatory spending and discretionary spending, mandatory spending has skyrocketed in the last few decades from the high 20% to almost 80% in a few years. The reason that's why is because things like education, military defense, infrastructure, that comes out of the discretionary column. That's why all this other stuff that we're talking about today is very important as far as finding a way to cap some of that where we can put those dollars back into infrastructure in other places.
Last question here is just about unanimity in your party. You look at tax reform. You've got the Ryan Brady proposal working its way through Congress. You've got the White House saying that Gary Cohn of the NEC is working on a tax reform proposal of his own. Is there too much stuff happening at once? Would you like to see a little bit more cohesion in the Republican Party at this point when it comes to tax reform or Obamacare or regulatory reform?
Sure. Yes, we need more unity. We need more cohesiveness. But we also have an obligation, each member representing their 750 to 800,000 people, to make sure that we're putting the best proposals, the best legislation, to use Speaker Ryan's A Better Way program. We want to implement all of that. And sometimes with different parts of the country, there's a little bit of a grind that goes through that. But I remain hopeful that we can come together and get some of these things done. If we can, I believe we cast the die for the next generation in a very positive way.